We've been dealing with questions, and let's continue in the same vein. We have enough questions for the rest of the evening, as a matter of fact. The first one's an interesting one. Is it possible that some chemical exists which, if ingested, might conceivably supply the body with the material to allow it to correct its own subluxations? I think perhaps it's more likely that an energy exists rather than a chemical substance. However, there's not really a great deal of relevance to this. How can I say there's no such thing as such a chemical? That's like somebody asking, do you think it's possible that if you got enough monkeys with enough typewriters, eventually they would type out War and Peace? Good philosophical question, because it can't possibly have an answer. There's no such thing as enough monkeys. If you say no, what would happen if you put in another 100 monkeys or another 100? Could there be a chemical manufactured? Yeah, how about strychnine? Isn't it possible that if we put strychnine in the body, the resultant convulsion could supply enough force by which a certain subluxation would become adjusted? Or maybe the same convulsive forces, unadapted, would cause 3 or 4 more subluxations. I don't know if the question was asked seriously or not. Could such a substance exist? I guess theoretically it could. Do I really believe that it does? Absolutely not. Remember, it is energy converted to a proper use that becomes an adjustment, nothing else. All right, next question. Should a lifestyle analysis, that is to say natural nutrition, exercise, rest, etc., be a valid part of the chiropractic practice? Should the chiropractor get involved in such important issues? Obviously, if the person leaves your office and goes back to a destructive lifestyle, then you have not been as effective as if they were to go back and change their lifestyle. I would say this question and the compassion behind it have probably destroyed the effectiveness of more chiropractors than any other philosophical question. In an attempt to improve people's lives, we set ourselves up as the inductive authority to tell them what their life should be. Again, I say to you, by what arrogance do we determine what somebody else's life should be? Aren't we doing exactly the same thing that we've accused the MDs of doing? If we are to give advice to people, it should not be to tell them what to do and what not to do. Not about their rest, not about their nutrition, not about their exercise. Remember, the exercise that will build up somebody's muscles and reduce subluxation, if done by somebody else, will cause subluxation. Is golf a good exercise? Well, you're using the muscles of your back. Shouldn't that strengthen them and lessen the possibility of subluxation? Isn't it possible that some of the golf swings could be used by the body, converted into an adjustment? Sure, that's possible. I wonder what happens, though, when you miss the ball and hit the ground with the club head. You think maybe that could cause the subluxation? It's such a dumb question, is golf a good exercise? It's a wonderful exercise for some people, and a very destructive exercise for others, and probably for the vast majority of people, it's both, constructive and destructive. Yeah, but Reggie, you didn't tell me, should I play golf? I had no idea. Reggie, every time I play golf, I hurt my back. Do you think I should quit? I mean, what a dumb question. Well, see, I need my exercise, and if I quit, you think swimming is better? How easy it is to say, yeah, well, swimming sounds better to me. How the hell do we know what their body needs? Let's get away from this inductive giving of bad advice to people whose bodies we don't know, and refer them to that one source of advice that does know about their bodies. Teach them about their innate intelligence. Teach them to tune into their body. You can't be a chiropractor unless you're teaching your patients chiropractic philosophy. What most chiropractors are doing is teaching their patients chiropractic physiology about subluxation causing this problem and that, and not teaching them any philosophy. Therefore, or thereby, not freeing the people from the tyranny of inductive thinking. If you're to serve a useful purpose in this regard concerning people's lifestyles, I would suggest you sit them down and share with them the thoughts that make you different, that make you qualified to understand man's relationship with his environment, the interrelationship of the parts, the need for harmony. Teach them fundamental philosophy, starting with the major premise. Then teach them about inductive and deductive reasoning, teach them about innate intelligence, give them a whole package so when they come to you with these questions, they are better equipped to answer them than you are. You are well equipped to answer the questions concerning your own body because you have communication with your own innate intelligence. When you go out and have 3 or 4 drinks and you wake up with a hangover, you can feel the hangover. You know what's happened. And if the next time you go out and have 3 or 4 drinks, you wake up with a hangover again, pretty soon you can put the things together and say, these drinks are causing that hangover. And you don't have to go to a physician and say, hey, do you think the booze is doing it? You know your own body. Teach your patients to know their own body physiologically, and above all else, teach them to understand philosophically where you get your expertise. Then you're giving them your expertise. If you tell them what to do every time, you're making them a slave. You're making them dependent upon your knowledge. You're becoming the paternal figure again. When you give a person a fish, you feed him for a day. When you teach him how to fish, you feed him for life. Teach your patients how to fish philosophically. Teach them the thought processes by which you determine when you will and when you won't take medications. That way you never have to say to a person, well, if it were me, I wouldn't take that medication. Or do you know what that medication is doing to you? The fact is, you don't know what that medication is doing to them. Neither do they, neither does the physician who prescribed it or the druggist who sold it to them. Nobody knows. It's just the game of trial and error. So why should we be giving that kind of advice based upon what expertise? Where do chiropractors get their medical expertise from? You have none. So instead of giving people the benefit of your ignorance, give them the benefit of your understanding. The thing that makes you so special is your understanding of the nature of life. You've got a philosophy. Nobody else even has a philosophy. You know, chiropractors today are so worried about MDs stealing their techniques, physical therapists practicing chiropractic. They can't understand that there's something strange about chiropractors objecting when physical therapists manipulate the spine, but it's okay for chiropractors to practice physical therapy. I was recently in Japan where the acupuncturists want to learn chiropractic techniques, and all the chiropractors are trying to learn acupuncture. Chiropractors get worried when medicine sets up subdivisions, subspecialties like physiatry, where they're teaching each other spinal manipulation. In France, for example, the sign chiropractor, or the French translation of it, appears over thousands of offices, and only a mere handful of those are trained chiropractors. All of the rest are MDs who practice manipulation for a living. If chiropractic is nothing more than spinal manipulation, any idiot can steal that from you in no time flat. I could teach any 12-year-old better techniques than most chiropractors use. If chiropractic is nothing more than spinal manipulation, medicine already owns it by law. What's the definition of medicine? The diagnosis and treatment of disease. By any means, they're not limited. You can only do it by drugs and surgery. The diagnosis and treatment of disease by dictionary definition and by law in every jurisdiction is the practice of medicine. So chiropractic, by its own choice, seeks to be a subdivision of the practice of medicine. Medicine already has its own subdivisions of practice. It has a subdivision called orthopedic surgery, in which some of the orthopods either manipulate the spine or relegate the manipulation of the spine on prescription to physical therapists. And then there's another subdivision of orthopedic medicine called physiatry, in which they're training themselves to do manipulation. If chiropractic is nothing more than spinal manipulation, they've already stolen that. The only thing they can't steal from you is the way you think. They can't steal your philosophy. If they did, they'd have to give up all the outside-in inductive medications they use. The entire practice of medicine is built upon inductive reasoning, trial and error. If they were to steal your philosophy, they'd have to give up everything else they do. It is your philosophy that makes you unique, and if you want to build a practice, build a community, and serve that community in the way that the MDs can't, then teach the world to be free from inductive reasoning and to understand about the innate intelligence running the body. That's the answer to this question. It's the answer to a whole lot of questions when you come to think of it. Now let's move on and take the next question. This one deals with something we talked about last week. I believe I said to you last week that I believe in truth in advertising, that the consumers have a right when they walk to a sign that says chiropractor, they have a right to know that when they get behind that sign, what they're going to get is chiropractic and not something else. Here's a question which derives from that, and it's a very good challenging question, challenging to me. Is it not misleading, in fact fraudulent, to have people come to you for backache, neckache, headache, etc., which is why people go to chiropractors, and then offer them a completely different service, such as subluxation correction? In other words, is it not fraudulent to do what I'm suggesting? Have them come in for treatment of their backache, their headache, their stiff neck, and then bait and switch. After you got them in for that, say, hey, well, we don't have that to offer. Here's what we have instead, and give them real chiropractic. Let me go on and finish the rest of the question before I answer it. The public concept of chiropractic is backache treatment. Aren't you being like the person who has a bakery, and when a customer comes in to buy rolls, you try to sell them a hat instead? Meaning a totally different service. If the customer comes in to have his neckache treated and you say, no, I want the whole family, including the kids, for once a week chiropractic for the rest of your life, aren't you in fact being fraudulent, switching them from one thing to another? Of course, the answer lies in the fact that chiropractic has lied to them all of these years. The sign on the window doesn't say bakery. It should. The sign outside most chiropractors' offices should say slip disc jockey instead of chiropractor. I think when somebody comes in to me and I sit them down and tell them the truth, that can't be fraudulent. I don't pretend I'm treating their backache while I'm really trying to restore them to something else. What I do is I say, no, that's not what I do. The confusion comes in when they say, yeah, but I went to other chiropractors and that's what they did. The fact is I can't be responsible for what other chiropractors did. I must be responsible for what I do. I cannot, in all conscience, turn somebody out back into the world as ignorant as they were when they walked in because they came in for a backache treatment. I'm going to say, okay, well, that's what I must give them. I don't give backache treatments. I never will. If that is to be regarded as fraudulent, then I'm going to go ahead and be fraudulent. But frankly, I think quite the opposite is true. I think when the sign says chiropractor and they come in and they get something else, that's fraudulent. And when they're told that that something else is chiropractic, that's even more fraudulent. Good question. Again, it may have been asked tongue-in-cheek, but it warranted an answer. I'm not going to answer these necessarily in the sequence in which I received them, because there's some that will take a lot more time than others. This one's a double question. We had two questions, and I put them together. Let's see what it is. Is there such a thing as holding an adjustment? It seems that back in BJ's day, people held adjustments for a long time. Now we find that people need adjustments much more often. By needing adjustments more often, I guess we mean needing chiropractic technique more often. Is it the high-tech world we live in? Is it our lifestyle? And the second part of the question is there such a thing as a holding adjustment? Several techniques claim that they hold an adjustment longer than other techniques. I'd like to address myself to that first. We're going to have to talk about the laws of physics. If I take a penny and I pitch it into the corner of the room, just pitch it over my shoulder casually, and it lands perfectly in the corner by accident, it will stay there for a certain period of time. either until the sweeper comes along or until there's an earthquake shaking the building or one of you little eagle eyes comes along and picks it up and puts it in your pocket, right? How long it will stay there has nothing to do with how it got there. If I meticulously place it into the corner, it's not going to stay there any longer than if I just tossed it casually and it landed there. The laws of momentum and inertia say that regardless of how it got there, it will remain there inert until it is the subject of some other motive force. So from that standpoint, there is no technique that is going to make it stay in place any better than any other technique. Is there such a thing as a good adjustment and not so good adjustment? No. There is such a thing as an adjustment or not. An adjustment is that perfect replacement of a vertebra by the innate intelligence, exactly where it belongs at that moment. It can be achieved by deliberate intent, by general intent, or sometimes by accident. Remember also that the innate intelligence is converting forces even without chiropractors. Adjustments are being made all the time. We only need to step into the picture when the body is unable to accomplish its own adjustment. We've already said there's no such thing as over-adjusting. Adjusting meaning putting the bone back where it belongs. You can't do that too often. The innate intelligence does it when it needs to do it. We're not moving the bone, we're not making adjustments. By that definition, you can't have over-adjustment. You can, however, have over-manipulation. What the result of that would be, I really don't know. Now, is it possible that we're not holding adjustments as well today as we did in BJ's day? I don't know. I can guess, I can hypothesize, share my reasoning with you. I don't really know. I think part of the problem is that the standards for determining the presence or absence of a subluxation have changed. Back in BJ's day, in the BJ clinic, there was one criterion only used to determine presence or absence of subluxation. That was pattern work. By those standards, I think most chiropractors practicing today could get people to hold an adjustment for a long, long time. I don't think our high-tech living has made nearly as many changes as we might like to think. I think people are getting lazier. I think we're not using our muscles as much. We have far more labor-saving devices, all of which contribute to negatives on the body, maybe causing adjustments to hold for a shorter period of time by introducing new motive forces. But I really think the major reason that people are not holding adjustments as well is that they are holding adjustments as well, but our criteria of determination have differed. Back in BJ's day, particularly in BJ's practice in the clinic and those that he taught, pattern work was really the only criterion. The criterion today seems to vary from chiropractor to chiropractor, and in most cases, the serious question that the chiropractor asks is, can I make it crack? And that, which is a totally worthless criterion, is the one which is used to see whether people are holding an adjustment or not. If they make it crack, they say, well, you see, he needed an adjustment. They don't even know he got an adjustment. There's absolutely no relationship between that cracking sound and adjustment. It's quite possible to get the cracking sound without an adjustment. It's quite possible to get an adjustment without the cracking sound. And it is also quite possible, we might add, that the cracking sound does occur with the making of an adjustment. So it's just a totally invalid criterion. It doesn't tell you anything. And when you think about it, almost every other criterion that is being used in chiropractic doesn't tell you whether there is or is not a subluxation. In which case, what do we need it for? I want to go back to what I said last week, and nobody likes being told that his technique could be improved. But I think the one place for improvement in almost every chiropractor's practice is a valid criterion to determine the presence or absence of subluxation. Something so good it can be used as a pre-check and a post-check. Something you can hang your hat on because it makes philosophical sense. So many chiropractors are using procedures in analysis that they were told are good. They're told when there's a subluxation, this gets hot. And rather than think and realize how stupid that is, they say, okay, that's what I'll base things on. Or they're told when there's a subluxation, this gets cold. Or this squeaks, or that doesn't, or the legs change. Think, for God's sake. Do any of these criteria make any bloody sense at all? First of all, they're totally inductive and a violation of chiropractic principle. And secondly, even in the inductive world of physics and our own inept understanding of physiology, they don't make any sense. The only thing I've heard of that makes the slightest bit of sense as far as analysis is concerned is this thing I shared with you last week about allowing the innate intelligence to make its own determinations about what bones should be moved and which ones shouldn't. And then just feel with our fingers what the innate intelligence is trying to do with a bone. If it wants to move it to the right, if a vertebrae appears to be to the right of the median line, it feels as though it's right of the median line, and all the squeaks or lack of squeaks that you could possibly want to seek are either there or not there. It is immaterial. If the innate intelligence is pulling it more to the right of the median line, that's where the damn thing belongs. It doesn't belong in the middle. The idea of chiropractic is not to line up the vertebrae. If anything, it's to line up the holes in the vertebrae. And the holes are not in the middle. The vertebrae are not symmetrical. Laminae might be thick on one side, thin on the other. A spinous bent, a transverse process longer or shorter or more club-like than its partner on the opposite side. The measurement from x-rays becomes ludicrous when the first measurement is eyeballed to determine where's the center. Where's the scientific accuracy in this? And yet all of these things are used as criteria. Of course, x-rays couldn't be a criterion anyway, unless you're prepared to x-ray people every time they walk in. Now, do people hold their adjustments better? Before we even get into a discussion of that, I think we owe it to ourselves to determine how we know whether they're holding or not. That means we have to have a criterion that we really trust for ourselves. And I invite any chiropractor listening to this to evaluate your own criteria philosophically and see if it makes sense. Then compare it with what I've offered philosophically and see if that makes sense. Then make your judgment and do as you see best. Another very serious question here. How effectively can the innate intelligence function under the influence of medications, and is it our responsibility, and what is our responsibility to a patient who is constantly poisoning himself with medically prescribed drugs? This question gave me a great deal of concern and difficulty in practice. Let's start off by saying there's no way on God's earth this body can function normally when its chemical balance is abnormal because of prescription medications. Let's talk about something simple. Let's talk about something I know about, hay fever. Hay fever is a failure of the body to balance its own histamine production. A person that has this condition is one who, in the presence of this foreign protein, let's say ragweed pollen, produces histamine to an excessive degree. Instead of producing enough to counteract this foreign protein and then stop, the allergic person produces histamine and more and more and more and more. And the idea of chiropractic is to restore control to the body over its own histamine production so it can get back into balance again. This person usually, during the height of the season, will take antihistamine to neutralize what the body is making. And the more antihistamine you put in, what's the body going to do? It's going to make more histamine. You're compounding the imbalance. How in the world is the body going to get control of this situation even when the subluxations are gone? Nerve channels are open. How can the body balance itself in harmony when it has to compete with these antihistamines coming in daily? Yeah, but once it's in balance, we'll stop taking the antihistamines. Why can't I take the antihistamines just now when it's bad, and then when my body doesn't need them anymore, I'll know. I'll stop sneezing, my eyes will stop running, and then I'll stop taking the antihistamines. It doesn't work that way because of the factor of time. Remember, there is no process that does not require time. That's part of an observation of a universal law. There is no process that does not require time, including the balancing of histamine production. Well, do you think you're going to give an adjustment and right away the body now has its histamine in balance? Could take days, weeks, months, years. And in some people, could be forever. And during this time lapse, if you're bombarding the body with more and more antihistamines, how's it supposed to regulate itself? Okay, now we've seen then that external chemicals do prevent the innate intelligence from making necessary adaptations. What does the chiropractor do about this to patients? Certainly, if the patients are taking over-the-counter medications, non-prescription items, then the legal situation is much easier. Legally, we have a right to say, I would imagine, I can't say what any jury or any court is going to say, but I would imagine that legally, if the drug they're taking is not on a medical prescription, but it's over the counter, then we could probably tell them it's a good idea to stop taking it. However, in so doing, we have left our own philosophy, and we've now become inductive thinkers telling people what to do. If you're dealing with a prescription drug, then of course you're immediately breaking the law if you suggest that somebody alter the dosage. To tell somebody to stop taking a medicine or to cut back on the medicine legally is in fact the practice of medicine. There's no court in the land that would not hold you guilty of practicing medicine, even though in the eyes of many chiropractors you're practicing good medicine. You know, sometimes if the only damn thing you ever did was to stop them taking their medicine, that'd be a major stop in the right direction towards a return to health, even if you didn't touch their spine. I think a lot of the people that are going to doctors are more sick because of the medication than they were from the disease before they went to see the physician. I agree with all of that. And yet I have no right as a philosophical chiropractor to tell other people what to do with their body or what not to do with their body. My job, again, is to teach them the philosophy. What makes me a maven? What makes me an expert on what they should or should not take? Nothing. Let me share with them instead my philosophical approach so that they will understand and be able to make judgments as to what they want to do with their life. I would never tell somebody, hey, you know, when you wake up at 2 o'clock in the morning with a raging toothache, it's wrong to take some medication so you can get through the night before you can see the dentist tomorrow. Who am I to judge somebody else's pain? Is it possible that all of that pain could cause subluxation? Well, I guess we can make a case for that. I would be a lot happier if the aspirin they took to kill the toothache pain were to go right to the tooth, deaden the nerve in the tooth. Of course, it doesn't. It circulates through the entire body and deadens every damn nerve in the body, preventing nerve impulses from jumping the synapse. That's how aspirin works. Sets up a chemical barrier at the synapse so the impulses of pain can't get through. I'm not sure that's a good thing for the body. But who am I to judge somebody else's pain? Why don't I instead teach them how to fish? Let them make their own judgment and not condemn them if they make a judgment different from mine. It's not my job. My job is to share my knowledge, my love, my care. They've got to take the responsibility for their own body and their own health. Will the taking of medicine interfere with normal function? Of course. By definition, the presence of medicine produces abnormal function 100% of the time. What are the similarities and the differences between the gentle technique that I spoke of at our last session and something such as shiatsu? Now, I don't pretend to know a lot about shiatsu. People have told me that some of the techniques used are as gentle as massage, and that's good. I like to see gentle technique, but there's a difference between my gentle technique and massage and my gentle technique and what most people call shiatsu. I must interrupt myself at this point to point out that just as there are 10,000 different definitions of chiropractic out there, all wrong, so there are as many different definitions of shiatsu out there, all wrong. I can very easily give an answer on shiatsu, and somebody else who practices shiatsu says, wait a minute, that's not what I do at all. What I do is the real shiatsu. What you're talking about is pseudo shiatsu. I can't even say pseudo shiatsu. Right? But do you ever talk with people who use, let's say, Gunstead technique? And you watch it, and they're doing their Gunstead technique, and all of a sudden they're doing something so totally different from what Gunstead would do. But they call it Gunstead technique. Where did you learn that? Oh, I learned it from somebody who took Gunstead. Or I learned it from somebody who learned it from somebody who took Gunstead, from somebody who once went to Gunstead. Huh? And they're all calling it Gunstead. Exactly the same is true in shiatsu or in anything else. It's very difficult to compare a specific technique such as I'm talking about with a total unknown that has a blanket label like shiatsu. And I don't denigrate shiatsu when I say this. I'm saying I don't know what is the real definition. I talked the weekend before last with a homeopath who said her philosophy was so close to ours. And I've lectured at Hahnemann Homeopathic Hospital, which is now an allopathic medical hospital in Philadelphia. Their idea of homeopathy is totally different from hers. Now, which is the real homeopathy? Surely Hahnemann should be. I mean, that's where homeopathy was born. But she claims to have the original homeopathy, and Hahnemann is wrong. And I have no way of judging. The same is true with shiatsu. I can only tell you what my technique is. If shiatsu has any similarity, or some forms of it have similarity, then they do. But the one major difference that I observe between my technique and anything else is that the purpose of my technique is to introduce a specific force for the innate intelligence to utilize, adapt, and convert into an adjustment. That's why I'm doing what I'm doing. A shiatsu person may do something almost identical, but if they're doing it for different reasons, it's not the same. I think the purpose behind what we are doing defines it much better than the appearance of what we're doing. Our purpose always must be to use the least amount of force possible, so perfectly located that the body can convert it into an adjustment. Nothing else will satisfy in chiropractic. The purpose of chiropractic, first, last, and always, is to allow the innate intelligence to convert our force into an adjustment. That's why we're doing it. Nothing like osteopathic manipulation, nothing like spinal manipulation techniques, corrective therapy techniques, orthopedic surgeons' manipulative techniques. They all have the function of altering the body to where they, the operators, want it. Our purpose always is to offer a force to the innate intelligence to restore control of the body to the innate intelligence. That's the difference between chiropractic thinking and all of those other things. All right, next question. Is vertebral subluxation a symptom? Now that sounds like one of those who cares questions, but it happens to be a very important one. And it has a good philosophical answer, maybe not a satisfactory answer to the person asking the question. Is vertebral subluxation a symptom? Such an easy question to answer. All you have to do is define vertebral subluxation and define symptom. Now we all know what a vertebral subluxation is, but who can define symptom? I could define symptom in such a way that you could say, well, you see, vertebral subluxation is a symptom. Or I could change the definition of symptom to mean something else, and then we could say vertebral subluxation is not a symptom. It all depends on your definition of the term symptom. For me, symptom might be defined, and I've not looked up dictionary definitions, symptom might be defined as some clinical evidence of an underlying problem. The symptom is not the problem. It's the evidence of a problem. Now that would not define subluxation because subluxation is the problem. A certain symptom could be indicative of any number of different disease conditions. A subluxation is not indicative of any disease condition. When there's a symptom, there's always a disease. A symptom means something is wrong that you can then track down and identify. Subluxation may have no disease at all. Clinical symptoms resulting from subluxation could be delayed 10, 15, or 20 years. So I can think of lots of reasons why subluxation could not be classified as a symptom. And as I said, it doesn't sound terribly important, but it becomes important when we pair it with another question. Isn't chiropractic analysis just another form of diagnosis? Oh, how often we hear this one. And this becomes a political hot potato. Because those who would like to practice chiropractic analysis are told they must first study all diagnosis. They are told by those motivated to tell them that chiropractic analysis is just another method of diagnosis. It's identifying the problem, the disease. The disease is subluxation. The analysis is the diagnostic approach. And you could make a case for this if you don't give a damn about the English language. Once you start to define your terminology, the argument I have just presented becomes totally specious. Let us define diagnosis. And let's understand that all diagnosis, by its very intent, is differential diagnosis. Diagnosis is the art of differentiating between one disease entity and another. The purpose of diagnosis is to put a name on the disease, so you know which disease you're treating. You can't intelligently treat any disease until you know what it is. If a person comes in with sciatica, and the real disease is cancer of the prostate gland, you can't intelligently treat the sciatica without knowing what the cause is. So the diagnosis is to identify between one and another. Differential diagnosis is to identify the disease for purposes of treatment. And chiropractors who treat disease, be it backache or any other disease, are mandated by law to do a differential diagnosis so that they may be aware of those disease conditions which society has decided are best treated by means other than chiropractic. In other words, referral. Many states have laws. Most chiropractors are examined for licensure in the quality of their diagnostic ability so that they can identify those diseases which the law would like you to refer to medicine, under whose tender mercies they got the disease in the first place. Never ceases to amaze me that chiropractors act as diagnostic referral centers for medicine. If medicine worked, they wouldn't be in your office in the first place. So we're going to do a diagnosis to find out what excuse we have for sending them back to the MDs. However, this is all Reggie's viewpoint, nothing to do with the philosophical discussion we're on. We must honestly admit that the purpose of diagnosis is to identify a disease. All diagnosis is differential diagnosis between one disease and another. If it's not differential, it is not diagnosis. It's identifying all of the symptoms and reading them in as many ways possible so that you understand the disease, to find its causes, its origins, and its best available treatment. If you're going to treat disease, then you must be able to diagnose so you can know which treatment or where to refer. Now let's look at chiropractic analysis. The term analysis does not mean differential diagnosis. The term analysis means, by dictionary definition always, an examination of the parts or divisions of a complex. The complex in this case is the spine. We're going to examine the relationships of the parts of the spine to see if they are in their appropriate relationships or not in their appropriate relationships, without any regard to whether disease is present or absent. Now, most chiropractors, acting within the law, do both, because the law now says you must do both. You're allowed to work on the spine, but if the person has a disease which you fail to recognize or fail to refer, then you are culpable in the matter of malpractice. And if you don't like that, change the damn law. That's in the law because you put it there, either by action or by inaction. Every chiropractic law that we have was put there by your actions or by your inactions. If you're happy with the laws, leave them the way they are. If you're not happy, change them. It's that simple. But spinal analysis, chiropractic analysis, is a study of the relationships among the parts of a complex. It has nothing to do with differentiating one disease from another. So, analysis is not diagnosis. Subluxation is not a disease, and it's not a symptom. Dis-ease, which results from nerve interference, may in fact be a contributory cause of disease somewhere down the line. But that's really totally immaterial. If we don't talk about sick people getting well, What kind of benefits of chiropractic can we explain to the public? Look, you cannot promote chiropractic to the public unless you're going to show them the benefits of being subluxation free. Chiropractic, for the most part, has taken the easy way out. And we've told them, if you do this chiropractic thing, you will get well, and if you don't do it, you won't get well. Then we've gone a step beyond that, and we've said, if you don't keep up with your chiropractic, you will get sick again. And if you do keep up with chiropractic, you will not get sick again, which is a lie, but at least it's a very clearly understandable lie. We've held out the promise of health. In fact, we've lied to the people because we've allowed them to believe that other health factors are not terribly significant. That subluxation is it. I remember reading BJ's advertising. You have no right to be sick when chiropractic cures all disease. Now that was the early chiropractic position. I don't think too many chiropractors hold that position today. So what they do is they say, well, if chiropractic can't cure all disease, we'll identify what the disease is, and if chiropractic can't cure it, we'll send them out. I'm suggesting to you that you take that away from the people, this false belief, this lie that chiropractic will keep them well or get them well. I'm suggesting you teach them instead that people are better off without subluxation, sick or well. Damn it, if you have cancer, you certainly don't need vertebral subluxation as well. You've got enough problems. Nobody needs subluxation. This question says, yes, but if we do that, what reasons, what good, valid reasons can we give them for keeping their spine free from subluxation? What does freedom from subluxation do for people if it doesn't get them well and keep them well? And let me say before we start this, that even though it doesn't get them well or keep them well, it eliminates one massive negative from their health pattern. The health equation is made up of many factors. Subluxation is one massive negative. Get that out of the way with regular adjustments, and they certainly will be better able to express their health potential, whatever that potential may be, and with due regard to all of the other factors which they have not removed from their life, like the air pollution, the Chernobyl radiation, the strontium-90 fallout, lack of sleep, smog environment, etc., etc., etc. Not to forget the most important of all, genetics. Remember my advice from a couple of weeks ago. If you want to live to a ripe old age, in total health, or the best health possible, pick your grandparents very carefully. The most important single factor in determining health is your genes. And unfortunately, you can't do anything about those. Keeping subluxation free will allow you to express more of your health potential. But it'll do a whole lot more than that. Subluxation reduces your health potential, but it also reduces your potential for everything else. We mentioned this before. I think in answer to this question, we should say it again. Every aspect of human physiology is chemical. Everything. You can't laugh without producing chemicals. You can't sleep without producing chemicals. You can't wake up without producing chemicals. You can't make love without producing chemicals. You can't thread a needle without producing chemicals. You can't do anything without making chemicals. The manufacture of those chemicals is controlled totally, 100%, by the nerve system. The brain passes impulses along the nerves by which the glands and organs make chemicals. If there is vertebral subluxation, chemical production is altered. It is out of harmony. Too much of this, too little of that. And anything that is out of harmony chemically interferes with your ability to perform any function at your optimum. What can people look for if they're subluxation free? If we can't promise them perfect health, can we promise them improved health? You're damn right. Oh, you mean my backache will go away? No, I can't say that. Well, how then? I mean, everything else is perfect in my health. The only thing wrong is my backache. And if you say my health will improve, that means my backache will get better, right? No, it means your health will get better. That you will better be able to express whatever life potential is in there. Doesn't mean that any particular symptom or disease condition will get better. It means your body will be more able to express whatever it has. It'll be able to do more of what it could do. But much more than that, it will be able to express all of these other potentials to a higher degree. You'll be able to think more clearly, concentrate better, be better coordinated physically, have less impulsive mood swings. Every aspect of your life can function better. You can extract nutrients from your food better. I mean, the country is vitamin crazy, when half of the country can't even utilize the vitamins they're getting because they have subluxations that are stopping the body from producing the right chemicals. Every aspect of life suffers when there's vertebral subluxation. In short, you have to be a damned idiot to go through life subluxated when you could do something about it. What benefit can you gain from being unsubluxated? Every benefit in the world. All right, that's the answer to that question. Let's see if I can read this one. Handwriting's not too good. It's mine. Because people are raised to worship the scientific, including medical science, what chance do we have of changing them? They leave our office only to get bombarded with the same false theories of a get-rich-quick, get-well-quick yuppie society. It's all too true. Sometimes you're ready to throw up your hands in frustration. You know, we're just a fraction of 1% of good, and everything else is bad. And they do leave your office, and they go right back to the same stupid, negative world, and everybody's willing to offer health advice. Everybody wants to tell them. What's the best thing to do for a cold, starve a fever, do this for that? Everybody's telling them, your little bit of advice is very likely to get lost. They come into your office having been raised all of their life to think inductively. And now you sit them down and you try and teach them a little bit of chiropractic, and they're not really ready to listen that first time. You teach them a little bit of physiology, the importance of the nerve system, and then they walk out and you say, well, I explain chiropractic. 2 years later, you find they're in the hospital having their appendix out and say, idiots, why didn't they come here? Why didn't they come all of these months in between so this appendicitis thing may not have even happened? Why didn't they come back to see me? Even if you did a perfect orientation, they forgot. You know how many times they're bombarded with the threats of what happens to appendicitis if you don't get it operated on? They leave your office, they pick up the newspapers. I walk into a chiropractor's office and I see magazines in the reception room filled with medical advertising. Or they got some bloody stupid television program on. General Hospital. Okay? Mucus Welby, MD. Have you seen all the medical shows on television? And if you have that in your waiting room, you're advertising the medical program to your patients. And if you don't have that in your waiting room, don't worry about it, because they'll go home and listen to it. And they'll read the ads. And they'll talk to their friends. And they'll talk to their mother-in-law. Everybody's got some advice different from yours. Don't you realize you're the only person in the whole damn world that has this chiropractic advice? They can go to 200 chiropractors and not hear this. I've had people, I sit them down for an orientation, and they say, boy, I've been going to chiropractors for 30 years. How come they never told me this? And I say, yeah, how come? How come? Chiropractors are not telling them. What's even worse is somebody now who comes into your office, see somebody who has been away. They came into you 2 years ago to have their backache fixed up, and you fixed it up, and you haven't seen them since. Now they're going to come back next week with the same backache. And you're going to explain all this good stuff to them about why they should have been bringing the kids in all these years. And they're going to say, yeah, how come you didn't tell me this before? What are you going to tell them? I don't know. But you've got to start telling them sometime. And do not believe that when you've said it, your job is done. A lot of it they didn't hear in the first place. You know, people hear 20% of what you say. That's why you must never, never, never talk about anything except this principle. If you say one word about their backache, that's the word they're going to hear. And they'll forget everything else. Never say anything other than principle. And then you've got to say it again and again and again. You must remember when they leave you and they go out to the bridge club or the bowling alley or the PTA or the church meeting, there's somebody going to be talking medical negativity at them. They're constantly being bombarded with this inductive garbage, listening to the biggest experts. And they want to make you an expert, only so they can compare you with their other expert. And when they get really sick, they're going to go to a specialist because he charges $150 a visit, and he's really an expert. This is the way they've been trained to think. Take a person into a clothing store and show them a suit of men's clothes for $150 and an identical suit for $750. Ask them which one they want. They'll take the more expensive one. So these people who are charging enormous fees per visit are having tremendous influence on your patients. And no matter how arrogant you are as a chiropractor, you don't even begin to touch the arrogance of the MDs when it comes to fees, especially the specialist MDs. So your people are constantly bombarded with negatives, negatives, negatives. And the only way to overcome it is to constantly bombard them with positives, positives, positives. Every opportunity you get, every time they walk in, reinforce their understanding. Don't just take a passive position, I will never say anything wrong. That's not enough. You've got to take the affirmative action. You've got to say something right. Now, I know from this point on, you're never again going to say to a patient, "Hi, how are you?" Because that means tell me your symptoms. You won't say that anymore. At least I hope you won't. But when they come in and volunteer it, you got to stop that kind of talk. When they come in and say to you, when they tell you how rotten they feel, it's very easy for you to say, "Oh, well, change the subject, quick, quick, quick." When they come in and say, "Oh, I feel wonderful. You have done so much for me." You want to hear more of that, don't you? That's when you have to shut them up. That's when you have to stop that conversation and get back to truth. "Well, I'm feeling a whole lot better today." All right, let's get on the table and let's see what condition your spine is in. How you feel doesn't tell us a whole hell of a lot. Now, it's easy for you to say that when they're talking negatives. Not as easy when they're telling you how good they feel. But you got to tell them the truth. And the truth is, lots of people feel dead today who are going to drop dead tomorrow. I feel good today who are going to drop dead tomorrow. So how good they feel doesn't mean anything. Tell them that. Tell them there's only one way to determine whether they have vertebral subluxation. Now, if you get on the table, we'll check it and let you know. And where are the kids? Their turn to get it. Reinforcement of this principle, and I most strongly advocate a continuing education program. Put on a lecture series twice a year. As we said, pick 4 consecutive Mondays, or 5 or 6, however many you think you can handle, and start from square one with all those patients who will attend and teach them the underlying philosophy that we've shared during these few weeks together. Share with them the contents of these tapes. Tell them a little bit, and then open up for question and answer. This question really is part of the one we just answered. How do we go about upgrading our practice when virtually every new patient comes in for the treatment of symptoms? How do you make the conversion? You're going to have to work your ass off. It is not easy. The line of least resistance is to listen to them and give them what they want. Anybody will pay you for what they want. What they want is to get rid of their backache. And if you come in and show them some voodoo that you hope will get rid of their backache, they'll listen to you, they'll pay you, they'll stay with you. They'll stay with you until their backache goes away, then you'll never see them again. Or until they're convinced their backache is not going away, then they'll quit. So you're building a losing practice. You've had hundreds and hundreds of patients come in the door since you opened your practice. Where are they all now? Where are they? How come they don't come back for their maintenance care? That's very simple. Nobody ever gave them good reasons. If you'd given them good enough reasons, they'd be coming in. How do you raise your practice? You educate. You have the answer that they need. I do not believe that the people out there are so stupid they don't want chiropractic. You just have to be flat stupid to be prepared to walk around subluxated once you know what subluxation is. They don't know because you're not telling them. How do you uplift your practice? You set in motion a plan. You plan an education program. Doesn't happen by accident. Cause and effect. What can I do to educate these people? I know, I'll mail them a newsletter. Bullshit. Newsletters don't do anything. It's good to send newsletters, I approve. But that won't educate them. That won't infuse them. What you've got to do is sit down and talk with them one-on-one. Oh, I hate to talk with people. Good, get into another profession. Be a cat burglar. The one principal job of a chiropractor is to educate. If you're not going to educate, you shouldn't be a chiropractor in the first place. The idea of chiropractic is to change their attitude, their thinking, not to patch up their bad backs. There's so much to be done, and you're out there crapping around treating backaches. Hey, you can make a good living treating backaches, true. But who cares? You can really change the world if you will just take the time and the trouble to plan a program of education. I would say number one is that you insist that every single new person coming in, one, sits down for an orientation with spouse about them and their kids. Two, equally important, attends a chiropractic night, a layman lecture as we used to call it. I don't like that term. Layman is kind of a put down, and lectures sound dull and boring. So a chiropractic talk, a spinal talk, call it whatever you want. You must have one of those every single month without fail, and you must insist that every new patient bring with them a non-patient. Lazy, lazy chiropractors. How many years have I been telling you this? And then you listen to some group of guys who come around and say, well, you don't have to do all that. What you can do is get all your new patients sitting down in the room and play my movie. And they'll charge you $5,000 for a movie that does absolutely nothing. Preaching to the converted. Where do the new patients come from? The whole idea is you sit these people down one-on-one and you talk with them. Don't talk at them the way a movie does. Give them a chance to talk back. Remember how we talked about active listening? Get them to explain to you how long they want to leave their kids subluxated, what the subluxations are doing to their kids' lives. And then when they fully understand that and they're committed and they're bringing the kids in, within 1 month, they're required, not asked, they are required to bring a non-patient to a lecture. Now, you've all been out and you've lectured. You've lectured at the Rotary Club and the Kiwanis Club and the PTA. How many people do you get in as patients? Damn few. Maybe one who has a backache. When it's all over, they come up and shake your hand and say, boy, I really enjoyed that. I learned a lot tonight. You ever see them in the office? No. Why? Because when they went to the Kiwanis Club, it wasn't to change their opinion about something. They're not stupid. They just weren't listening to what you were saying. They went there to have a good time. They went there to do their raffle business and have their dinner and drum up some business for their own insurance company. You know, everybody belongs to the Rotary Club or the Lions Club, so they can drum up business. They're not there to listen to your business. When you have a layman lecture where every patient is required to bring somebody, here's what happens. You tell this new patient coming in, okay, here's the ticket to chiropractic night, which is on the 15th this month. In fact, there are 4 tickets here, one for you, the spouse. These 2 are for non-patient friends. Now, these tickets are $5 each. I've added them to your bill for the first visit. Take them. Don't let them go to waste. Now, if you don't want to take the money, put it on the scholarship fund. It's about time somebody supported some of the schools. Tell them the money's going to a scholarship fund and put it in there. But let them realize the value of what they're getting, and if they pay for those seats, they're going to use them. And then the next time they come in, you ask them, what's the name of the people you're bringing next Wednesday night to the talk? Oh, they didn't seriously believe it. I mean, if you rip them off for 2 tickets, they don't care that much. They don't intend to come anyway. But now you tell them, I want the names of the people you're bringing. And they say, hey, this is serious. Well, I didn't get anybody. Well, when you come in on Wednesday, bring in those names for me. When they come in on Wednesday, ask them. This is where the CA in the front office can be so useful, to asking them, do you have those names for us yet? I mean, you've got books to know who's coming in and who's coming to the lecture. And you ask them again, do you have those people? No, I couldn't get anybody. They asked their next-door neighbor. She wasn't interested. So I couldn't get anybody. You got other neighbors. You go bowling. You got friends at the PTA and the church. Find somebody. You know, chiropractors are so tough on some things and so chicken on other things. This is something where you really should be tough. Go out and insist. Understand this. If you don't insist, somebody who should be a chiropractic patient is going to remain subluxated. Now, you prepared to live with that? Silence is not golden. It kills people. It's that simple. People who don't know about chiropractic live a half a life. You have a moral obligation to whip your patients into this kind of enthusiasm to bring somebody else with them. And now what they're going to do is they'll go out and ask, and they get turned down. They're asking. Finally, they'll find somebody. Who's going to come? The people that are interested. All of those that didn't want to come stayed away. Now you have a pre-screened audience. If you have 50 of your new patients that month who bring in 50 non-patients with them, I defy any one of you to talk about chiropractic for an hour to an interested audience and not have 80 to 90% of them sign up that night. This is where your practice comes from. I think chiropractors are the laziest people in the world. They say, how do I lift up my practice? Well, you get up and talk to people. Oh, I couldn't do that. What else could I do? You can stay where you are. That's what else you can do. You're like the people who want to get well, and you say, well, the first thing you've got to do, I had one of these the other day. What can I do about this terrible back of mine? I was injured in an automobile accident, and I had a fractured hip, and the MDs put it together, and I've had pain ever since. It's been 8 years now, and I feel terrible. I said, fine, it's easy. I'll give you the name of 3 good chiropractors in your area. Pick any one of them. And I did. A week later, she called me, can you come over to the office and talk to me? She's the secretary of my building contractor. So, yeah, sure, I'm going to come down to the office anyway. I went over there, and she said, look, do you think this is any good? She's got some machine to hang by her boots, hang upside down. Do you think this will do any good? And I said, that's a piece of junk. I told you what to do. I gave you the names of the chiropractors. And she said, oh, I can't go there. It's too far away. Well, what about this one? Well, he wanted $100 for the first visit. She's going to pay $300 for this bloody machine. What you need to get well is chiropractic. Oh, but can I do something else? And that's you. What your practice needs to do to get well is talk to people. Oh, but I can't do that. Can I do something else? Yeah, you can. You can fail. Comparatively speaking. Comparatively meaning go outside your office and look around all the people living in the neighborhood who are not coming in. That's failure. When 95% of the people in your community are not getting chiropractic care, that's failure. I don't care how big your practice is, you failed those people. So let's just tell the people what chiropractic is and how much they need it, and insist that every new patient accept the responsibility of bringing somebody else with them. The conversion rate into chiropractors, I'll tell you this, I know you as chiropractors need time for your vacations and your golf and your boating and your skiing and your kids and your gardening. You need all those things, and you're entitled to them. And when you're out there hitting that little ball around, remember all the kids that are dying because you'd rather be hitting the bloody ball around. You see? When there are enough people taking care of the chiropractic needs of the community, then you can have free time. Until then, your moral obligation is to work your ass off until everybody's in chiropractic care. That's the way I see it. I don't care if you make $200,000 a year or $500,000 a year if you starve. That's not my concern. My concern is that there are kids on your block that are dying because their parents don't know what you should be telling them. That's the way it is. How do you build a bigger practice? You start to do it. You know what to do. How do you build a better practice? You know what to do. Go home tonight and make a list of 10 things you should do to build your practice. And do half of them when you build your practice. You don't need me to tell you what to do. You already know. Write them down and start doing them. You must plan your work. You must make a plan. Put it in writing so you can look at it. Go home. First thing to do is pick the date of your next layman lecture. Write it down. Show it to somebody. So when the day comes close and you're finding the excuses not to do it, you can all know what a bullshitter you are. Right? Commit yourself. Write it down. Plan your work, and then work your plan. All the plans, all the writing in the world not going to do you any good unless you activate them. Make a list, and then when you do it, cross off, that one's done. That one's done. Next, what's next? And just keep doing it and doing it. I defy you to do the things that cause a successful practice without the effect being a successful practice. God, when you think of some of the chiropractors who've succeeded, and you think of their personality, you think of their technique, I mean, really, think about it. And if they can make it, you sure as hell can. And when I say make it, I'm talking about increasing whatever you're doing now, increasing the number of people you're seeing and how well you're serving their needs.